Well, hello everyone. Dr. Dan Miller here again from Beaverton Family Chiropractic. Glad to have you all here. It's been a while since we've been together. Lots happened, as you know, but life is getting back on track. And so tonight we have an important topic. It's one we've done before, but we're going to look at it from a different perspective, and that is fighting the comorbidities of COVID-19. Specifically tonight, we're going to be talking about the race against heart disease. And so before we get started here, just maybe a little bit about me. Back and forth here, switching buttons, perfect. So as many of you know, I've been around in practice a little over 28 years, a native Oregonian, never lived outside. And my wife and I love to get out and do things, going hiking, bike rides, as you see here. And so we just love the Northwest, and we just love being here. And so we feel real blessed and fortunate to be here. Even with the fires that we had, we're thankful that those are getting back under control, and definitely our prayers go out to the families that have been directly affected by that as well. So let's jump in the topic here for tonight. And so that's really the issue of our time together. So a study came out not that long ago from the CDC talking about how 94% of the people that had died of COVID had other underlying health conditions. Now, what that means is that people that had COVID and they died, they had as many as 2.5 other chronic health issues: diabetes, heart disease, cancer, obesity, high blood pressure. And so what we're finding is that a lot of people are focusing on the virus. What I would like to do is to take a different approach and talk about how do we help our body be healthy in the first place. So if God forbid we did get that, how do we help ourselves be stronger in the first place? Let alone, how do we help ourselves just be healthier in general? As we continue on, other places like, come on, work with me here. The Cleveland Clinic has issues that they're talking about heart patients and about COVID-19. And then World Health or Heart Federation. In fact, yesterday was World Heart Day. And so very timely here as we have this discussion. But again, people with underlying health conditions such as heart disease are more vulnerable to COVID-19. It doesn't mean if you have heart conditions or diabetes or cancer that you're more likely to get it. The studies are inconclusive with regards to that. But what we do know is that if you do get COVID-19 and you have an underlying health condition, your risk of more serious complications and death actually goes up. I think it's no surprise that based on our discussion here, the answer to this question is going to be heart disease. And in fact, I broaden it a little bit: cardiovascular disease and heart disease. Sometimes those terms are used interchangeably. Heart disease specifically is discussing issues relating to the heart proper. Cardiovascular disease is the entire vascular system of the body, which includes the brain. Which includes the blood vessels to the brain, but more importantly, includes the heart itself. So as we look at some of the numbers with regards to heart disease, one person in the United States dies every 36 seconds as a result of heart disease. Let that sink in. One person every 36 seconds. Over 650,000 people die in the United States every year as a result of heart disease. The current cost now is over $219 billion. That's not just the treatment of the condition, but it's actually how much money would be lost to the individuals and to the economy if you're not able to work. In fact, this number here is actually from 2015. A more recent study I saw says even $289 billion, which the worry is that by the time you get to 2035, over $1 trillion. So that's a big issue. So by knowing what causes or what our risk factors are, that can help us make some changes. So high blood pressure, high cholesterol, and we're going to talk about that here more in depth in a moment, smoking, diabetes, being overweight and obesity, poor diet, physical inactivity, and then excessive alcohol use or abuse. And so making a small change in any of these other areas are going to lower your risk. Now, you're going to see some cross concepts here of other topics we'll be talking down the road, for example, diabetes or obesity. And so our topic tonight is actually the first in a three-part series. So next month, we're going to be talking specifically about COVID-19 and cancer. And then when we get into November, we're going to talk about diabetes and obesity. So please mark your calendars, tune in, share this message with other people. Because we're global, anybody in the world has an opportunity to listen to this. So share it with your friends and neighbors, but also your aunt and uncle and family across the country. So what are the symptoms of heart disease? Well, here's the thing that's kind of crazy. There really isn't a lot of clear symptoms, but what we find is for many people, the first symptom of heart disease is either a heart attack or heart failure. So heart failure is when the body is just tired and it's maybe oftentimes towards the end of its days, or it just gets exhausted and it's strained. What we really want to focus more on right now is heart attack. So these are the symptoms that are common. People have heard these. The thing that we really need to understand, though, is that the underlying heart disease itself is often silent. The CDC, the World Health Organization, they all indicate that there's no obvious signs of this. And so what we have to be careful of is that we wait till we have a specific symptom. Sometimes it's too late. And so we want to make sure that we're aware of these. But ideally, the best treatment is prevention. So if we can minimize the risk of having heart disease in the first place, we're obviously a lot better off. But let's talk about this a little bit further. So when we talk about cardiovascular diseases, what we're finding is that 31% of all global deaths are tied to cardiovascular disease. And what we're finding is 85% of those are tied to heart attack and stroke. 85% of deaths related to heart disease or cardiovascular diseases are tied to heart attack and stroke. Think about those numbers. Now, what's crazy is that when we look further on in the study, it's saying that most of these issues can be prevented by addressing behavioral and lifestyle issues. So that's where our focus and discussion is going to be tonight, is talking about those. And again, we're going to lay out a lot of different options, a lot of different resources. And so what I want to caution you here now is do not get overwhelmed by the fact that you have to do all these or there's no hope. And that's just not the case. What I'd encourage you to do, one, if you don't have a pad of paper and a pencil, get one soon. Try to get one as we're talking if you don't have it. But make some notes as we're having this discussion tonight. And then what I'd like you to do is to review it and pick maybe 1 to 3 things tops that you're going to do to really help understand what's going on. And so for you, just make some simple changes, 1 at a time, 2 at a time, but don't try to do everything or you're going to go nuts. Now, a lot of things we hear from people is like, well, I'm on medications for cholesterol level. How does that affect it? Well, what we're finding is that that's been a changing or maybe even a moving target. If we go back to the 1960s, people were looking at dietary cholesterol. That's when the whole low-fat craze started. And their focus was, let's get rid of the fats. But what's interesting is the heart disease rates continue to climb. So it really wasn't the fat that was the issue. Now, we'll talk in different workshops in our office that bad fats can be the issue. But what we found was that the heart disease did not drop as we looked at dietary intake of cholesterol. In fact, a study done by UCLA showed that 71% of the people, and this is a study done throughout the nation, 71% of the people that had a heart attack had normal to below normal levels of cholesterol. Having been in practice for a number of years, even taking nutrition classes in chiropractic college, the number that is looked at for total cholesterol level keeps changing. They keep lowering the number, thinking if we make it lower and lower and treat it with statins or other medications or dietary, that will see people have lower levels or risks of lower levels of heart disease, but that's just not the case. And so if you've never had a heart attack, if you've never had a stroke, there may be better ways to predict heart disease in the body. And so what we find is that there's a number of different tests. So one is looking at cholesterol ratios, don't have that in the right order, but looking at the omega-3 fatty acid ratios in the body. There's 3 key areas that they look at. And so having blood work that looks at those particular things can be very valuable as far as an indicator of the risk of heart disease. Other blood tests, fasting insulin levels, fasting blood sugar levels, All those things can give you an indicator if you're at risk for heart disease. Now, I want to caution you, whether it's heart disease or cancer or diabetes, or as we talk about later, a nerve interference, there is no one single definitive test that gives you an overall indication of health. Let me say that again. There is no one simple single test that you can take, that you can have done to you, that can be performed, that's going to give you the all-conclusive, you are 100% healthy and no risk of problems versus you've got some serious issues. It's a combination of tests. So blood work, physical exams, conversations with your doctors, all are tools that are being used to help you determine how your body is. Until we get to the point like in Star Trek where we can just use a little tricorder and read the whole person, we just have to use multiple different tests. But working with your doctor, whether it's me or with another care provider that you're with, that's going to be the real key, is creating a relationship with him or her and really working together to help you make sure that you're making the best choices possible. So where do we go from here? Again, there's going to be a lot of information, a lot of discussions here. Some are going to be obvious, but maybe not easy. Some of may be less obvious, but when you look at it, maybe not as hard as you may have thought in the first place. So as we move forward, I think the simplest thing to just look at is, number one, stop smoking. So if you are a smoker, and this is going to be a reoccurring theme in many of our workshops, you really need to look at the very least, decreasing, if not eliminating, how often you're smoking. When you look at some of the information we get from the World Health Organization, what they're telling us is that about 21% of all coronary heart disease is attributed to tobacco use and secondhand smoke. So about a fifth of all deaths tied to coronary heart disease is tied to cigarettes and secondhand smoke. And so by eliminating that, you just decrease your risk of that. What's interesting is that if a person is a smoker and you choose to stop smoking, within 15 years, your risk of issues relating to that have dropped back to a normal non-smoking individual. And you get immediate benefits as soon as you stop smoking. So definitely something you want to look at. Now, it sounds simple, I'll just stop smoking. I know it's not that easy. I've never been a smoker. I've had families and friends that have smoked, and I know it's a difficult task to stop. But finding, lowering your risk, finding people to help you is just important things to do. The next thing is sleeping more. It's amazing how many of our patients are coming in these days and just saying, I'm not sleeping very well. I'm stressed, I'm worried. And so finding ways to get more sleep is an important thing. When we look at the numbers, we've all been told we need about 8 hours of sleep. But there's kind of a range, and it also depends on your age. As you're younger, newborns to even school-age children, you need more sleep than you do as you get older. But don't think you can always run on fumes for a while. Even as an adult, the average adult needs 7 to 9 hours of sleep. And depending upon your particular personality and temperament and life, you might need 9 hours, where someone else in your family may only need 7 hours. And it may be too that if you have increased levels of stress, you need more, or healing, you need more sleep. And sometimes you have seasons of life where you're having to stress yourself, and so you have to unfortunately go for less sleep. So helping yourself really realize what you're shooting for. And if you're not able to make it, as we move into our next topic, that can help. And that's creating a peace plan. I say peace plan because every day is a battle for your time. It's like you're at war. Coworkers need things, bosses need things, banks and credit unions need your time here, and taxes and homework and home care and chores. Everything's vying for your time. So if we don't deal with budgeting our time and looking at ways to help more peace in our life, we're going to move into an issue we're starting to deal with more and more stress, which John Hopkins is telling us is that stress actually can increase the risk of heart disease. So we don't want to take this lightly. We know that stress is bad, and we know that it can set us up for many different health issues. The topic tonight's heart disease, so understand that that's going to be another case. And so finding ways to minimize stress is helpful. Now, I know for myself personally, so some transparency here, that the more I watch the news, the more I listen to the radio, the more I get on social media and read all the different posts about all the different things in our society that's happening right now, and there's many, it can be overwhelming. I'm not saying you don't need to be informed, but be very careful about becoming obsessed with the news, because it can become hopeless when we do that. So pick your poisons, if you will, but be careful about spending all day in front of the TV, constantly checking your Facebook posts. It's overwhelming, and it's hard on the body. One of the ways to get a handle on your day is to really look at how you spend your time. So what you're seeing here is a blank Google Calendar. Most people will have some sort of a Gmail account. And so you can actually create a calendar based on your daily activities. And I'm not going to go into that here. We'll have another workshop probably the first of the year when we look at time management and how to set goals for the new year. But suffice it to say, the great equalizer for every man, woman, and child on the earth is time. We all have 24 hours in a day. The difference between a Warren Buffett and the person that's homeless is not the time, but in many cases how we use it. Now, please, I'm not making political comments here. I'm not talking about privilege and whatnot. What I'm just saying is we all have 24 hours. And so we can start making changes wherever we are in life by how we allocate our time. So what I do when I sit down and I look at my schedule is I start with the things that are fixed. Now, being in practice and seeing patients, I know the times I need to be in the office. So those are fixed on my schedule. I also know when I do trainings with the team, and I know when I do my report writing in the office and when I read x-rays. I also know when I have consultations with patients or when I have personal training and development, and I put all that into the calendar. And so I do that with every area of my life. If I travel, I put it on the calendar. If I have, what night I'm doing with my date night with my wife, I put it on the calendar. And so I encourage you to do that. Put down all the things that are fixed. Put down all the things that you know are coming up. And then what you do is when you look at even go to the point of putting down when you need to sleep and when you need to wake up. Now that sounds crazy, but when you've got all that in the TV on your calendar, then you start putting things like, when's my TV time? When do I exercise? When do I go to the grocery store? Maybe you have division of labor in your household, and one does grocery shopping, one does garbage, one does dishes, one does cooking, or overlap. You can schedule that as well. But when you've got all that on your calendar, you're going to step back and go, you know what? I might have 2 to 4 hours, in some cases 7 to 10 hours of unaccounted for time that I have in the week. How you use those discretionary hours is going to be the difference in how much stress you're under or not. So if you have an extra 7 hours, but you have all these projects you're not able to get done, schedule them. If you want to be able to have time to just go to the beach, schedule it. Put it on the calendar to say, listen, I'm not doing anything else because I budgeted my time to be able to do that. A little bit longer discussion than I was intending there, but this is a key component, because if you want to make changes, you have to make a commitment to the time to do them. This is a big topic in our office, and it's nutrition. You've got to eat smart. The more inflammatory foods that you tend to eat, the greater your body has a risk of heart disease, cancer, and other things. So as we look at our daily activities as far as food, there's just some basic things that we need to go over, and this is universal for absolutely everybody. What we most often need to add to our diet are healthy fats, clean proteins, and fresh berries and veggies. Nobody would argue with those things. Quantities, amounts, all that kind of stuff, we're going to save that discussion for another day. So make sure you like our Facebook channel. You'll get notified when we do our next nutrition workshop. Really popular topic for a lot of people. The things we need to reduce or even eliminate are bad fats, sugar, processed foods, alcohol, and non-organic produce when possible. So you see I have down there below ewg.org. That's the Environmental Working Group's website. On their website, they have what's called the Clean 15 and the Dirty Dozen. So what they're looking at is that, statistically speaking, what products are safe to buy versus things that you really should buy organic. So for example, on the Clean 15, you'll find things like bananas and avocados and broccoli of all things, because there's little likelihood that they're being sprayed. Now, the Dirty Dozen, those are the things that you're pretty sure that there's going to be lots of chemical toxicities in the non-organic world. Apples and berries are always at the top of the list. Kale now has made that list. And so take a moment and just pull up that app on your phone or look it up on your computer and just see what are some of the things, as you're looking at your budget dollars, that I don't necessarily have to buy organic. But then look at the things, especially the top 5 to 10 of that Dirty Dozen, that you really should try to look at getting organic whenever possible. Where you shop, there's different stores that have more and more organic produce. So just talk to the people in the produce section. Some stores only carry organic produce. Some have separate sections for that. So become more familiar with your grocery store and just spend some time with that. I don't think this next topic is a surprise to anyone either, and that is you need to move more. What I've been hearing from countless patients with COVID is that with most people working at home, fewer people are going outside. The gyms are just now starting to open back up. People have been gaining the COVID-19, and that's pounds. And so working at your laptop, at your kitchen table, or sitting on your couch at home, and then spending time watching TV, sitting at your couch at home or your chair, or watching movies on the weekends, we're spending more and more time being sedentary. And so this is a great maybe wake-up call for you to go outside while we still have the nice weather here in Oregon. We've got some beautiful days still ahead of us. Keep your social distancing like it's being recommended, but get out and go for a walk, go for a hike, go walk around your neighborhood, say hi to your neighbors from a distance, and get to know the people that you live around. But we got to get up and get moving. Now, people say, well, how much is enough? Well, when we look at the American Heart Society, what they're telling us is go the other direction when you push the buttons on your laptop. What they're saying is that if you could perform 150 minutes, so about 2.5 hours of moderate exercise, moderate activity exercise in a week, that's a good place to begin. Or 75 minutes of higher activity or higher intensity exercise. Now, let me caution you here. If you're new to exercise, number one, make sure you're talking to your healthcare provider as far as what's right for you. Don't feel like you have to go for a run or a jog. If you don't like that, there's many different things you can do to be active. And so you got to start someplace. Again, you got to get up out of your chair. In fact, if you are a person that's working from home and you're on the computer a lot, get up every half hour. You don't have to do anything fancy. Just get up, wiggle around, sit back down. Or, if you printing stuff, walk across the room, move your printer across the room if you can. As you get stronger, especially if you haven't been exercising for a while, increase the intensity. We also want to make sure that we're not just doing cardiovascular exercise. We also want to do some stuff that causes muscle strengthening. And so resistance exercises. If you have exercise equipment at home, dumbbells, barbells, awesome. If you have exercise bands, that can be helpful. But something as simple as a couple cans of soup or a jug of water can be used for resistance exercise. Not only does it help build muscle mass, increases the overall fitness of the body, but that resistance activity also helps with bone density and minimizes your risk of issues causing osteoporosis or even osteopenia. And the byproduct, if you will, is that you just feel better. Research actually shows that exercising as much as 30 minutes a day can decrease depression and anxiety better than medication. And so kind of a win-win-win thing. On the American Heart Association website, they have different activities that you can do at different levels. You don't have to do these. I just thought it was a great different option you have. They had been putting out a couple new ones a week, if not a day. YouTube channels, we've had resources that we've had available through the office as well. So the key is not so much what you do, but that you do something. So I would encourage you, please get off the couch. If you've got a family member that needs to make some changes too, maybe go together for a walk or start one of these exercise programs at home. Find a YouTube channel, find an exercise class online that you can take. Or if you've been working out at a gym or some sort of a fitness studio that they're closed or they had closed, you might check their website and see if they have some online options that you can go to as well. I think what makes sense, though, is that what runs and controls every single part of the body is the nervous system. So your heart doesn't beat without some communication from the brain. Your lungs don't breathe without some communication from the brain. Your arms don't contract. Your stomach doesn't digest food. Your colon doesn't eliminate stuff. Your kidneys don't filter. You get the idea, unless we have a proper nerve supply. Ultimately, within the brain is an innate intelligence and wisdom that manages every single part of the body. And as long as that communication from top to bottom and bottom to top works well, your body should be better able to express health. Now, in the case of heart disease specifically, there's actually some studies, I just showed one here, that specific adjustments of the upper neck can actually be very helpful in lowering blood pressure. And I'll actually say normalizing. This one's talking about lowering, but I've seen also studies of people that had low blood pressure, the body started to normalize it because, again, the brain's going to control that. And if there's a poor relationship in the spine that's interfering with that communication between the brain and the body, there can be a problem with the body's ability to function normally. Now, what makes our office unique is the way that we analyze the spine. We do very specific spinal correction work here. So from the examination to the postural evaluation to the way that we analyze the movement and function of the spine, sometimes even including x-rays, we're looking at how your body's functioning and comparing that with normal. And every single exercise, every single rehab and stretches that you're doing at home are all intended to help your body become as close to normal as possible. So we take spinal adjusting and spinal correction to a much higher level than most offices. And as a result, we have very happy patients and we get very happy results. And so here's just a few people that we have in our office. If I get my buttons to work right here, just some happy people and all ages. So we work with patients from newborns all the way up into the 90s. As long as you're breathing and your heart's beating, your nervous system can be affected by the nerves, communication to the brain. And so what we do helps that so your body can benefit from chiropractic care. You'll find a lot of professional athletes work with chiropractors because what we find is that if there is a restriction or interference in the brain's ability to control the muscles, reflexes could be affected. So a lot of sprinters, a lot of NFL players, a lot of professional basket players in both genders work with chiropractors because it helps their body perform just that much better. And so don't think that you're too young. Don't think that you're too old for chiropractic care. In our office, we can modify how we work with the patient. As far as the techniques we use, the most important thing is that we work with the body and help it to be able to communicate better. So if you're not currently under chiropractic care, something that I would encourage you to do is to call our office. And we're going to give you an opportunity to come in the office for an evaluation. Normally it could be as much as $89, but if you call and mention this webinar before next Tuesday evening, so you have less than a week, if you call by them, I'll offer that opportunity for only $40. Now, there are some limitations. We'll go over those. But what we're going to be doing when you come in that day is we're going to sit down and we're going to discuss your concerns. we're going to review your history and what's brought you to this point in the first place. See if we can find some correlation to that. And then we're going to do a spinal examination. So we're going to look at things like your posture. We're going to do range of motion. We're going to do some orthopedic and neurological testing to really round out what's happening. And then we're also going to do some computerized evaluations of the musculature of the body. Now, again, that could be as much as $89 or more. By calling the office and mentioning this, we're going to offer that at only $40. Now, this will extend to all members of your family. So each individual person would only have to pay the $40. And again, we're happy to help you see actually what's going on in your body and see how we can help you. So where do we go from here? Well, number one, I'm going to encourage you, if you're not under chiropractic care, to please call the office and do what you can to get in as soon as you can to see how we can help you. As you're taking notes, there's probably one or two things that came across your mind tonight to go, I really need to do something there. I need to start minimizing some of the bad foods I'm eating, or maybe I need to get off my couch. So again, pick the one or two, maximum of 3 things that you're going to start working over maybe the next month or so to make some changes. And then when we reconvene in October for our next workshop, maybe add 1 or 2 things more. So don't put the pressure to trying to change your entire world right now, because you'll become overwhelmed, you'll get frustrated, and you're actually going to go backwards as far as your overall health, because 1, you're creating more stress, and 2, you're just going to give up. And once you lose hope, it's a lot harder to get that back. So one of the things that we really hear from a lot of our patients is that not only do they find that their bodies and their health improved, but early on they find that they start to get hope. And with hope, lots of things can improve. So I mentioned our next workshop. So what's coming up in October on the 22nd, it's going to be a Thursday night next month, is we're going to have our next topic up called The War Against Cancer. So again, we're sticking with the topic of fighting the comorbidities of COVID-19, but we're going to talk about how cancer is affected by this and how you can help your body decrease the risks or manage it if you do have cancer. And we'd love to be part of your team with regards to that. The beautiful thing about this webinar, by doing it online, is that it's available for people to continue to watch afterwards. And so if you're watching this after we went dark, please know that the offer is still available for you. Call the office by Tuesday, October 6th. If you have friends that would like to see this, whether they're in the area or not, share the link with them. Let them have an opportunity to see it. And then lastly, if you have family members that you're concerned about, have them see it as well. And you can watch it over again yourself. And so the thing that's nerve-wracking for me is that because this is available forever, it makes me nervous. And so I'll keep working on communicating better and talking slower and really giving you tools to have the best opportunity to regain your health. And really the mission in our office is to help people transform their lives. So I'm going to sign out. I thank you for the opportunities. And if you have any questions, feel free to call the office, or you can make comments down below. And down the road, we will have an opportunity to address those, either messaging you back or addressing them in the lines there. So with that, have a great evening. Take care, and God bless.